Our consultations are an unrushed opportunity to get to know you as a patient and to understand what it is you're trying to achieve from a hair transplant. It's an opportunity for me to work out whether hair transplant surgery is right for you as an individual. On the day of the consultation, we spend a lot of time discussing the principles again, making sure that we understand your medical history, understand what it is you're trying to achieve from a hair transplant, and any concerns that you have. I then examine your scalp in great detail. This is a really important part of the process. I use a camera known as a trichoscope, which shows images under high magnification on a large TV screen, so both you and I can see the detail of your scalp as I'm examining you. This allows me to be sure that you have healthy hair and the right characteristics and quality of donor hair to allow a transplant to be effective. I'm looking for very fine hairs to create the soft naturalness of a transplant, and I'm also looking for thicker hairs to create the density that we'll require. I'll be examining your recipient area to be certain of what the diagnosis is that's caused your hair loss, in case there are other treatments or investigations that we need to consider. We then talk about the options for hair transplant surgery if we feel it's appropriate. This is a really important part where I spend time examining your face shape, your head shape, where your hair sits currently, where it's likely to recede to in the future, and design something that's going to sit perfectly and blend perfectly with your hair and your facial features. It has to look right from every angle, so we spend a lot of time examining it, and it has to feel right artistically and medically. After agreeing on a hairline design, we will then decide whether you have enough donor hair to treat this area, and then we can decide whether a transplant is going to be right for you. Importantly, we will also be deciding whether you have enough donor hair for the future, how much hair you're likely to lose in the future, and how much donor hair you have to supply that need. We'll talk through any questions you have about the assessment, and also any questions you have about the surgical process, how you prepare for surgery, what happens on the surgery day, and very importantly, what the recovery process is like. I'm very keen to make sure that surgery is offered to the right patients at the right time, so we'll explore how this might fit in with your lifestyle, your work, whether haircuts or head shaving is required at the time of surgery. At the end of the consultation, we'll answer any questions that you have, but then we'll keep channels of communication open because we like to be available to answer any questions that you have in the future. You can always email us or call us if you have anything else that you want to explore, or you can come back for another consultation if you think that would be helpful in your decision process. Sometimes we connect patients with past patients so they can get a feel for what the process of surgery is like from someone who's been through it themselves. Importantly, we want our patients to know that we're always here for them. Any questions, any concerns, we want to explore them because we want to make sure that surgery is offered to the right person at the right time and for you to feel comfortable with the process.